If Losartan is in your pill organizer right now, there are 5 specific things that interact with it in ways most prescription conversations never cover. At least one of them is something you have probably done this week without a second thought. Not because anyone is hiding this information, because the appointment where Losartan was prescribed covered the dose, the purpose, maybe one side effect, and moved on to the next item on a list that was already running short on time. What did not get covered is what happens when Losartan meets a salt substitute sitting on your kitchen counter, a pain reliever from the drugstore shelf, a hot week in summer with not enough water, a supplement a friend recommended, or a quiet decision made at home to simply stop taking it. None of these 5 things sound dangerous in the moment. A seasoning swap, a tablet for a sore knee, a herbal product from a health food store. Each one is the kind of decision most people make without a second thought. That ordinariness is exactly why they matter. I am Dr. Raj Patel, 15 years in clinical practice working with adults managing blood pressure. Today, I am going to walk you through 5 specific things to avoid while taking Losartan, the mechanism behind each one, and exactly what to do instead. Stay with me through all 5. Because the 5th one connects directly back to the first 4 in a way that changes how you think about all of them entirely. Before we get into the list, I want to give you one piece of context that makes everything else make sense. Losartan is an ARB, an angiotensin receptor blocker. It works by blocking the angiotensin II receptor, preventing the blood vessel constriction that angiotensin II would otherwise trigger. Blood vessels stay more relaxed, pressure comes down, but the same mechanism that makes Losartan effective makes it specifically sensitive to 5 categories of interference. Unlike some blood pressure medications where interactions are uncommon, Losartan's mechanism intersects simultaneously with kidney function, potassium regulation, hydration status, and inflammation pathways. That intersection is why the 5 things on this list are not hypothetical edge cases. They are the 5 most common sources of Losartan-related complications in adults over 60. One thing I want to be clear about before we go further: do not stop, reduce, or change your Losartan dose based on this video. Everything I am about to share is information to bring to your next appointment, not a decision to make independently. Your doctor prescribed this medication knowing your full history. Any change to it needs to happen with them. Now, 5 things. Thing 1. And this is the most counterintuitive danger on this entire list because it comes from doing something that is actively marketed as the healthy choice. Here is the mechanism. Losartan blocks the renin-angiotensin-aldosterone system. One direct consequence of that blockade is that the kidneys retain more potassium than they otherwise would. For most people on Losartan, this stays within a safe range when kidney function is normal and diet is consistent. But add a significant potassium load on top of a medication already raising potassium levels, and the combination can push potassium high enough to disrupt the electrical system of the heart. The source most seniors never suspect is not bananas. It is salt substitutes. Many low-sodium alternatives sold right next to regular table salt, often labeled heart-healthy or doctor-recommended, replace sodium with potassium chloride. A senior told by their cardiologist to cut back on sodium buys the substitute, uses it liberally on every meal, and is now loading potassium into a system that the medication has already primed to retain more than usual. Here is what that looks like in practice. A patient whose blood pressure had been well controlled on Losartan for over a year began experiencing unusual muscle weakness and an irregular heartbeat. Nothing in their medication had changed. Nothing in their diet had obviously changed. The only new addition was a potassium-based salt substitute their doctor had suggested for sodium reduction. The combination with Losartan had pushed potassium to a level affecting cardiac electrical function. A single blood test identified it. A dietary adjustment resolved it. But the window between the first symptom and that blood test was one nobody needed to navigate. High potassium does not always announce itself clearly. It can present as unusual muscle weakness, persistent fatigue, cramping in the legs, tingling in the hands, or a fluttering, irregular heartbeat. And sometimes there are almost no symptoms at all, right up until there are serious ones. Electrolyte powders, sports recovery drinks, and certain meal replacement products also carry meaningful potassium loads. They are not prescription products. Nobody thinks to mention them at an appointment. That is exactly why they matter. What to do instead? Do not use potassium-based salt substitutes while on Losartan without explicit guidance from your doctor. Use herbs, lemon juice, or small amounts of regular salt for flavoring. Before starting any electrolyte supplement or recovery drink, check the potassium content and mention it to your pharmacist. That conversation takes 5 minutes and it closes a gap that causes real harm. Thing 2, ibuprofen and naproxen, medications sitting in almost every medicine cabinet in America, reached for without a second thought for a sore knee, a stiff back, a headache that will not quit. The interaction with Losartan operates through a specific and well-documented mechanism that most people on this medication have never been told about. Losartan works partly through its effect on the kidneys. The RAAS blockade changes how the kidneys handle sodium, water, and blood flow regulation. NSAIDs inhibit prostaglandin synthesis. Prostaglandins play a direct role in maintaining kidney blood flow and sodium handling. When prostaglandin synthesis is inhibited by regular NSAID use, two things happen simultaneously. The kidneys retain more sodium and water, directly counteracting Losartan's blood pressure lowering effect, and kidney blood flow becomes more vulnerable to restriction, creating conditions where kidney injury can develop faster than most people expect. The combination of Losartan and regular NSAID use is one of the most well-documented causes of preventable kidney strain in older adults. Not because either drug is dangerous in isolation, because their combined effect on kidney blood flow creates a vulnerability that neither drug creates alone. Here is what this looks like in practice. A patient whose blood pressure had been stable on Losartan for 18 months began taking ibuprofen regularly for a flaring knee. 6 weeks later, their blood pressure readings had climbed back into ranges that prompted their doctor to increase the Losartan dose. Nobody connected the ibuprofen to the blood pressure change until a medication review 3 months later. The dose increase they never needed was reversed. The ibuprofen was replaced with acetaminophen, and the blood pressure returned to its previous stable range within 4 weeks. 3 months of unnecessary dose escalation from a tablet that cost a few dollars at the drugstore. Think of it this way. Losartan widens the pipe through which blood flows to the kidney. Regular NSAID use partially closes a valve downstream. The kidney is now receiving less flow than either drug alone would cause, and it responds by retaining sodium, which drives pressure back up and strains the tissue that was already under load. What to do instead? Acetaminophen is the first-line alternative for pain relief on Losartan and does not carry this interaction. Topical NSAID gels applied directly to a painful joint deliver far lower systemic concentrations than oral tablets and carry substantially reduced interaction risk. If regular oral NSAIDs are genuinely necessary for a chronic condition like osteoarthritis, that is a specific conversation to have with your doctor rather than a decision made quietly with an over-the-counter purchase. Thing 3. And this is the interaction most specific to seniors on Losartan and the one most directly connected to summer heat, illness, and the biology of aging itself. Losartan's mechanism depends on adequate blood volume to work safely. It is calibrated for a well-hydrated body. When blood volume drops through dehydration, whether from a stomach bug, a hot week, heavy sweating, or simply not drinking enough, the same dose of Losartan that was perfectly calibrated can act dramatically differently. The kidneys, already operating under RAAS blockade from Losartan, become significantly more vulnerable when blood volume is low. The reduced blood flow to the kidneys combined with Losartan's effect on kidney circulation creates conditions where acute kidney strain can develop faster than most people expect. Blood pressure can also fall too low. dizziness, weakness, faintness, and in severe cases, fainting. The medication did not change. The body's internal environment changed, and the drug is now operating in conditions it was not designed for. Here is what makes this especially dangerous for seniors specifically. After 70, the hypothalamus becomes progressively less sensitive to thirst. You can be significantly dehydrated and feel completely normal. There is no warning signal, no reliable internal alert. The thirst mechanism that worked dependably for decades has become less precise exactly when the stakes of dehydration are highest. Here is what this looks like in practice. A patient who had been stable on Losartan through an entire winter came to the clinic in July with dizziness, weakness, and a blood pressure reading significantly lower than any in the previous 12 months. Nothing had changed in their medication. What had changed was that a 10-day heat wave had increased their fluid losses while their blunted thirst response had prevented them from compensating. Their body was running in a dehydration state their medication was not designed for. Hydration was restored, blood pressure normalized, no medication change was needed, but the hospital visit to establish that took most of a day. What to do instead? Stop relying on thirst as your hydration gauge while on Losartan. Thirst is no longer a reliable signal after 70. Aim for 6 to 8 cups of water daily consumed consistently throughout the day, rather than all at once. During illness, with vomiting or diarrhea, or during prolonged heat exposure, ask your doctor specifically what to do with your Losartan dose on those days. This is one of the most important questions a senior on Losartan can ask, and it is one of the least commonly asked. Which of these first 3 was new to you? Drop it in the comments below. I read every single one, and your answer helps me understand exactly what this community needs next. Thing 4. The category almost nobody thinks to mention at a doctor's appointment because supplements do not feel like medications. They are natural. They are from a health food store. They were recommended by a friend or a family member who meant well. But 3 specific supplements interact with Losartan in ways that are clinically significant and almost universally overlooked. Potassium supplements first. The most direct interaction. Adding supplemental potassium to a medication already raising potassium levels creates the same risk described in Thing 1 through a different source. Many seniors take potassium supplements believing they are supporting heart and muscle health. On Losartan, without medical guidance, they may be pushing potassium toward levels that create the opposite effect. Never take potassium supplements on Losartan without explicit guidance from your doctor. St. John's wort, a widely used natural supplement for mood and mild depression. It activates CYP enzymes in the liver that accelerate the metabolism of Losartan's active metabolite, reducing the medication's effectiveness and allowing blood pressure to climb back toward pre-treatment levels. The rise happens gradually over weeks, which is exactly why the connection is almost never made. The patient does not feel the supplement working against their medication. Their doctor sees a blood pressure reading that has drifted upward and considers a dose increase. The supplement is never mentioned because it does not feel relevant. Licorice root. Found in some herbal teas and supplements marketed for digestion, stress relief, and adrenal support. It contains a compound called glycyrrhizin, which causes the kidneys to retain sodium and excrete potassium, directly counteracting Losartan's mechanism and raising blood pressure. Here is what this looks like in practice. A patient whose Losartan had been working well for 2 years began taking a herbal supplement a friend recommended for better sleep. The supplement contained licorice root. Over 6 weeks, their blood pressure readings climbed steadily. The supplement was not mentioned at their next appointment because it did not feel relevant to a blood pressure conversation. The connection was only identified during a full medication and supplement review prompted by the climbing readings. The supplement was stopped. The blood pressure returned to its previous controlled range within 3 weeks. What to do instead? Bring every supplement, herbal product, and over-the-counter product to your next appointment. All of them. Your pharmacist can run a full interaction check in minutes. Never assume that natural means safe alongside a prescription medication. Your body does not distinguish between a compound from a health food store and a compound from a pharmacy. It responds to chemistry. And chemistry does not care about the label. Thing 5. The one that connects directly back to everything described in the first 4. And the single most dangerous decision I see seniors make with Losartan. Quietly, with the best intentions, without telling anyone. When Losartan is stopped abruptly, whether because of a side effect, a concerning reading, a decision to try managing without medication, or simply running out and not refilling promptly, blood pressure does not return gradually to its pre-treatment level. The renin-angiotensin system that Losartan has been suppressing rebounds. Angiotensin II activity surges, blood vessels constrict, and blood pressure can climb rapidly and significantly above pre-treatment levels. The rebound can begin within 24 to 48 hours of the last dose. In adults with existing cardiovascular disease, this surge carries genuine stroke and cardiac event risk during the rebound window. Here's the connection to the first 4 that I want you to hold on to. The most common reason seniors stop Losartan quietly is a side effect or a concerning reading. Dizziness from the dehydration interaction in Thing 3. A high potassium reading from the salt substitute in Thing 1 or the supplement in Thing 4. A blood pressure reading that has climbed because of the NSAID interaction in Thing 2. The patient sees a problem, concludes the medication is causing it or failing them, and stops. But stopping the medication in response to a problem caused by one of the first 4 interactions creates a 5th problem that is more dangerous than any of the first 4 individually. Here is what this looks like in practice. A patient who had been on Losartan for 14 months developed dizziness and a slightly elevated potassium reading. They concluded the medication was no longer working for them and stopped taking it, planning to discuss it at their next appointment 3 weeks away. 5 days later, they presented to the emergency department with a blood pressure reading among the highest they had ever recorded. The dizziness had been from mild dehydration during a warm spell. The elevated potassium had been from a new electrolyte drink they had started. Neither required stopping the medication. The rebound from stopping it required emergency management. What to do instead? If you are experiencing a side effect, a concerning reading, or anything that makes you question your Losartan while you are taking it, call your doctor's office that week, not at the next routine appointment. That week. Describe what you noticed. Describe what you did. The conversation is straightforward. The alternative is not. Never simply stop and wait to see what happens. The window where you are waiting is exactly when the rebound risk is highest. 5 things. A salt substitute that replaced one risk with another. A pain reliever that quietly pushed blood pressure back up over weeks. A hot spell that changed how the medication behaved in a body that did not feel thirsty. A supplement that felt harmless because it came from a health food store. And a quiet decision to stop that created the most dangerous problem of all. None of these look dangerous in the moment. Each one is the kind of decision most adults make without ever connecting it to their blood pressure medication. Losartan works by changing how your arteries and kidneys behave continuously. Every day it is in your system. These 5 things are the 5 most common ways that continuous relationship gets disrupted without anyone noticing, until the disruption becomes a symptom that lands someone in a clinic or an emergency department. None of them require you to be more cautious in general. They require you to know these 5 specific things. Now you do. Tell me in the comments which one was new to you. I read every single response. Everything in this video is based on published clinical research and is intended to inform and empower you. It is not a substitute for the guidance of your personal physician. Your doctor knows your medical history, your kidney function, your full medication list, and your individual risk profile. Any change to your Losartan or any other medication needs to happen in conversation with them, not independently. Always consult your healthcare team before making changes to your medications, diet, or supplement routine. I am Dr. Raj Patel. Take care of yourselves. I will see you in the next one.